Good morning, ladies and gentlemen. We will be starting shortly. I think we're just waiting for a few more attendees to start streaming in. So we'll be starting in about 1 to 2 minutes, okay? Thank you for your patience.
Samantha, Gabriel.
Okay, good morning, everyone. We have some of you streaming in, and I would just want to say good morning, ladies and gentlemen. We are going to start very, very shortly, and I think we will be starting in about 1 minute's time. So give us your patience as we are awaiting those coming in. Okay, but before we begin, I would just like to ensure that you are all fully rested and going to be in charge of listening to exciting new news. My name is Samantha, and I am the GM of Breast Cancer Foundation. I will be your host and moderator for today's session. But I would like to now start, okay? And I would like to welcome all of you on our webinar on new drugs for breast cancer and healthy skin solutions. While there are many, many familiar faces and names out there, there are many here who are also new to our community. And I would like to take this opportunity to share a little bit about what we do at Breast Cancer Foundation. So if you can just give me 2 minutes of your time whilst we await.
Hi.
Okay,
Yep.
so what do we do in Breast Cancer Foundation? Okay, so I'm going to move very, very quickly
Okay,
because
okay.
we,
I will send Mrs. Wong the Facebook Live link so she can watch from Facebook Live instead.
okay, so let's just begin. So what do we do? In Breast Cancer Foundation, you see all these beautiful women here. This is what we do. We talk about supporting the warriors as they journey through this journey. We are so privileged to be able to partner with them, and we learn so much from them. And what we want to do is ensure that we want to eradicate breast cancer as a life-threatening disease. And here we talk about advocacy, and also we talk about how we're able to support, to befriend the warriors as they go through this. And the men are very, very important to us because they are the support structure for us in this entire journey. So it isn't just a woman's issue, it is a societal issue where we are going to partner together on this journey. Why is this so important? Because here it is something that we can all do our own parts in it. If we look at here, these are the latest statistics. 1 in 13 women will develop breast cancer before the age of 75. So as such, I think what's really alarming is that this number has actually increased threefold in the last 50 years. And this is something that is highly preventable if we're able to do the right things. And if we are able to empower and also advocate to our loved ones. Why is it so? Because if it is detected early for breast cancer, you have a 90.7% chance of survival. That's very, very high. And I think we all play a special part in doing and spreading that news to our loved ones. So what is key here is that there are two things that's really important. And this is the prevention part. When we talk about breast self-examination as well as mammogram screening. If we talk about a breast self-exam, this is something that you as a woman can do every month. And this is usually you do it once a month. If you're still menstruating, it's day 7 to 10 after menstruation. You do the breast self check. Or if you stop menstruating, then you just put it in your calendar once a month. The key here is that you need to know how your breast, the shape and the feel of your breast. And so if there is a change, you are able to immediately highlight to your doctor, who can then do the necessary action. So please note that you need to check whether there's a lump or thickening of the breast in the armpit area, whether there's anything with regards to the nipple and any changes in the skin texture, in the areola, any discharge, and any change in the breast size or shape. It's really important. Now, this is one of the best methods, and it's something that you can do in the privacy of your home. We do have this code available, which you can scan and download. This is available on our website, and it will teach you how to do it, as well as give you a link to book a mammogram. A mammogram we have available is a full sponsorship program that addresses the needs for all eligible low-income women aged 50 years and above with valid CHAS card, blue or orange. And this is available at all polyclinics. So do sign up if you want to go for your free mammogram. The screening schedules are important. Your monthly breast self-examination should start from the age of 20 onwards, and mammogram screenings should start from 40 years and above up to 49, where you do it once a year. And if you're 50 years and above, it's once every 2 years, and combine that with the annual clinical breast checkup. We do have these books available, which are also downloadable on our website. So we indicate the various risk factors and how to seek the various treatments available with your doctors. For younger women, we have this book available too. This is actually sharing with you journeys of young women being diagnosed with breast cancer. Here, we talk about their journey and how they have overcome this, and it is more on the emotional, psychosocial aspect. So for psychosocial support, we do have this available for women and for the men and the caregivers. We have on the online support group, we have English, Mandarin, young women support group, as well as for caregivers. Now, caregivers, you are very, very important in the whole ecosystem. So if you need to have that safe space for you to share what are your needs, please sign up with us. And of course, I mean, these online support groups, we run it every month. And we've just launched a new support group called Advanced Metastatic Breast Cancer. We only just launched it last month. So if you know of any loved ones that's going through this and they feel that they just need to talk to someone that has this, do connect with us. We do have a whole host of activities that you can join us in, and they're at various things. We have crochet, we have art, and then we have the higher impact stuff such as Zumba, yoga, and of course the high intensity would be dragon boating. Do call us up and find out more. And we do run training programs for both cancer warriors, as we call them, as well as the caregivers and family. So if you do have are undergoing chemotherapy and are experiencing some of the side effects with regards to the hair loss, we do have a wig loan program, which is complimentary. Do contact us and we can walk that journey with you, of which you can borrow wigs from us, as well as a person who has had a mastectomy. For those who are in the lower income group, we do have a prosthetic bra program available. Okay, so that's what we do in Breast Cancer Foundation in a nutshell. Now I have the privilege now of the fact that today we have two very, very special guests with us. And today we're going to learn how breast cancer treatment affects our skin and what we should do to address any sensitivities and allergic reactions. Now here, we have two special guests. One is Dr. Carmen Wong. She is a medical oncologist and senior consultant and medical director of Icon Cancer Center. And she'll be sharing with us about the latest drug treatments for breast cancer. Now, our next guest is Mrs. Elizabeth Wong, who is a director for Results Clinic and Results Med Spa. And she will be sharing with us on how cancer treatment can affect your skin. And we're going to learn how to get practical advice and tips about body as well as skincare regimes that will ease the discomfort while you're going through the cancer journey. So coming up next, let me join me in welcoming Dr. Carmen Wong, who will share with us about the latest drug treatment for breast cancer. Thank you, Dr. Carmen Wong.
Hi, everybody. Welcome and thank you for spending your very special Saturday morning for 1 hour with us. And I'm Dr. Carmen Wong. I'm the medical oncologist. And probably I'm the one who make many of you not so pretty. And today you will have a fun 1 hour learning about what cancer treatment is being done for early breast cancer after surgery and what can be done to make things better. Next slide, please. Now, just then, Samantha mentioned that 1 in 13 women will be diagnosed with breast cancer by the age of 75. And you look at this pretty lady, they say it will not be her. It is not quite so. So she did have breast cancer. Next slide. And she did undergo chemotherapy, and this is her during chemotherapy. Now, why I was interested to give this top part of it, I need to thank this lady. She was sharing me one day, she was walking after chemotherapy in town. And there was a stranger, he came and talked to her to say, it must be very difficult, poor thing. And her reply was so candid. They say, you don't need to be sorry. You didn't give me the cancer. You should tell me that I am beautiful. So I realized as doctors, we always tell people what is the problem and why are they looking ugly, but without telling them that, yes, it is there, but you are beautiful and you will be beautiful. So when Elizabeth asked me to give this talk, I am not familiar with giving this lifestyle talk. I find it very interesting, and I'm here to ensure that not only the chemotherapy and treatment make people living longer, it is also our role and duty to make them continue to look beautiful. So one word for all of you is that you are beautiful and you will be beautiful. And this same positive lady, next slide, become the front page in Straits Times because now she is an entrepreneur with the purpose after diagnosed with breast cancer. So therefore, after diagnosis of breast cancer is not doom and gloom, and many actually evolve to be so much better in their life ahead. Next slide. Now I fall back to my job as a doctor talking about how do we treat breast cancer, early breast cancer. People will ask me, Doc, I had surgery already. Why do I still need to see you? Am I not being cured? The answer why we give adjuvant, that means after surgery, systemic therapy, giving to the body, is with the goal of eradication of micrometastatic tumor cell after surgery. And as a result, we improve breast cancer outcome, leading to a longer cancer-free as well as overall survival following diagnosis of breast cancer. And the treatment option will depend on the tumor biology of the disease, and for which I believe that your surgeon and your oncologist will be addressing you quite clearly about the various options possible. And my talk is just briefly talking about what are those options and what are those treatments do to your skin. Next slide. We do know that 60% of Asian breast cancer are estrogen receptor positive. That means that those cancers are driven by estrogen in the body. And the way to target the treatment is to block the estrogen on the tumor cell. And the most common and the longest standing drug is called tamoxifen. And the drug has been in the market for more than 30, 40 years. And it gives people side effect of hot flushes. 25% of the people on on statistic, put on about 10% of their body weight. So therefore, exercise and stay slim are important. We learned over the past 5-6 years that in a premenopausal woman, that means the woman who is still young, having menses, making the menses go away by either surgery to remove the ovary, medicine to put the ovary into sleep, or radiotherapy to radiate the ovary will stop the function of the ovary, leading to a lower estrogen level in the body. Nevertheless, the ovarian ablation effect will give people a lot of skin and body lifestyle toxicity, including hot flushes, skin changes, hair loss, loss of libido, as well as hirsutism, which I will expand further. Among women who are postmenopausal, that means that your ovary is no longer functioning. The drug, including this group of medicine called aromatase inhibitor, we call AI, it causes a lot of joint discomfort, hair loss, and dry skin. We know that this combination of treatment do improve breast cancer outcome in the premenopausal subgroup. Combining OA and AI, the benefit is better than OA combined together with tamoxifen, is better than tamoxifen alone. And your doctor will discuss with you why you choose A but not B. So this is a discussion that you will make with your doctor. And among the postmenopausal women, we do know that the AI, as I have mentioned here, the benefit of cancer outcome is a little bit better than tamoxifen. Next slide. Now, how about chemotherapy? Now, this number, AB, ACTD, become very familiar among some of you. Those are the drugs that we use for treatment of breast cancer in early disease following diagnosis. Unfortunately, all the drugs other than the carboplatin and the capecitabine does cause hair loss. So therefore, the patient will ask me, how come my friend didn't have hair loss? Maybe your friend is undergo a different type of treatment so that the drug itself doesn't cause hair loss. Now, recently, we do use a co-cap machine to reduce the amount of hair loss. Not completely, but some of them are fairly satisfactory because they still think that they keep some of the hair. And the combination regimen are very familiar to many of you. They call AC, they call T, they call FEC, they call AC, whatever that is there. Now, in combination, they cause side effect of hair loss, numbness over the finger and the toe, acne on the faces and the body, rashes, hyperpigmentation, and nail changes. And I'll address some of them. Next slide. Now, targeted treatment is seen in about 20% of all breast cancer, 15 to 20% of Asian population are HER2 positive breast cancer. And in this particular subgroup, anti-HER2 antibody using Herceptin, Perjeta, and T-DM1 has been widely used. Now, increasingly in some subset, but not all, immunotherapy with checkpoint inhibitor, with Keytruda and Tecentriq has been used in the treatment of early breast cancer. And among these drugs, among the immunotherapy subgroup, 20% of them will develop rashes. And these targeted treatments are usually used in combination with chemotherapy. Next slide. Next slide. Now, we do know that we do know that after one becomes menopause, there are situations of estrogen deprivation, and as a result, collagen become less. We see skin sagging and mainly around the eye, around the nasal fold. And I'm interested to find a picture that even Angelina Jolie is also in the same group, that she also seemed to have some sagging of skin. So this is something we see when there are more estrogen deprivation. Next slide. And likewise, the lack of estrogen also causes some degree of hair loss. And as a result, women will say that, look, doc, how come I stop chemotherapy? I'm still having hair loss. And some of that may be just a menopausal issue. Now, there is no, next slide. Now, we do know that aromatase inhibitor, we call AI, has been used to treat breast cancer. The AI alone does cause hair loss in a patchy manner. Now, there is no magic to treat hair loss. And as doctor, you use minoxidil at about 5%. We ask the patient to use massage. My Indian friends told me to use coconut oil. I think that there's really a lot of treatment being recommended. But I think lately there are more and more people looking at hair transplant as a form of treatment of alopecia. Next slide. Now, hirsutism, I'm talking about some of them have no hair, and some will tell me that I have too much hair. The picture on the left is a very interesting picture, that hirsutism in somebody who are postmenopausal. The one on the left, they have some other medical illness, not menopause alone. You can see that they grow hair in the man's manner. And what you see on the right side is some of the patients will complain that they have more facial hair after chemotherapy. And it may not be due to the chemotherapy alone. It may be the fact that one goes into menopause, and as a result, increasing in androgen imbalance and causing that their hair growing in different part of the body, especially over the face. We'll tell them that maybe you can go to have it shaved or even go for IPL to remove this excess hair. Next slide. Next slide, please. Now, we mentioned that chemotherapy do cause hair loss. We know that the cold cap can prevent some of them. I will tell my patient that many things I cannot guarantee, but I'm sure that their hair will grow back. But interestingly, a lot of them told me that after the hair come back, they become curly hair. So many of them has straight hair and turn out curly. Some of them has black hair and turn out to be a bit more gray after the chemotherapy. Next slide. Now, both the chemotherapy and the menopause cause the skin to be very dry. And then many of them will come to say that, look at my skin, it is so dry. And it's mainly over the lip area and around the chin. So hydration become very important, and Elizabeth will go further into this. And next slide. Now, a lot of the patients are on this drug called Taxotere. And you look at the picture on the left, Gabriel, just point to the nail and look at these ridges. And you will find that why is the nail like that? There are lines. And you look at it, each line actually represents one cycle of chemotherapy. And this is the body telling us that the body is undergoing changes. And each ridge is one line of chemo, and this is the effect of chemotherapy. And the one on your right is because there are further damages on the nail. As a result, the nail may be dropping off. Now, what can circumvent that? Some of my colleagues will dip the finger on the ice water during the Taxotere infusion. I give my patient cold gloves sometimes to keep the area cold, as a result to reduce this incidence. When that happens, there's very little thing we can do other than keeping the nail clean, put on antibiotic cream onto the nail bed. Next slide. Now, this is another nail changer that you see with Taxotere. Next slide. Now, when we give chemotherapy, a lot of us do use steroids. And as a result, because of the steroid flush, a lot of them has actually acne eruption during the chemotherapy, compounded by the fact they have hormonal changes. So this is a picture we see very commonly. People get very upset to say, Doc, I have this coming on. And this acne pimple rash is a common phenomenon. We'll tell them to use some form of topical antibiotic, sometimes and even oral antibiotic, some exfoliation, and you have all the solution that Elizabeth is going to tell you later. Next slide. And sometimes this acne rash will be seen on the forehead, and the most common area is on the upper part of the body. Next slide. Now, hyperpigmentation is not uncommon among some of the drug, especially the drug adriamycin, that some of you call it the red devil, and the 5-FU and Xeloda. And they will say, look, Doc, look at my tongue, I become darkened. And this darkening of the tongue is due to the chemotherapy effect, mainly the adriamycin. And many of them will see that, look at my pigmentation, and this is what we call melasma. It is a combination of hormonal changes as well as the chemotherapy effect. And fortunately, these are transient, and over time, it will go away. Next slide. Now, we have talked about all the ugly thing about chemotherapy. I need to show you a pretty picture to say after chemotherapy, it will all go away. You saw the first Botox head lady become what she is now. So this is after chemotherapy, and the next slide is my last slide. And this is 24 years after chemotherapy. My dear friend Kelly is still as beautiful as ever. So I want to tell all of you, You are beautiful and you will be beautiful, and don't let other people have pity on you. You have all the drive to be better and do better. And I wish you all the best. Thank you for your attention.
Thank you, Dr. Wong, for sharing and affirming how these women are our beautiful warriors. Now I'm going to pass the session over to Mrs. Elizabeth Wong, who will be actually sharing with us practical tips on how to look after our skin and our body during this journey. Over to you, Mrs. Wong.
Okay. Can you all see the screen?
Yes.
It's fine.
Yes.
And you can hear me?
Yes.
Everything's fine. Good morning, everybody. It's a pleasure to be able to address all of you, although I can't see anybody except my own screen. But thank you, Dr. Carmen Wong. That is most enlightening. It's extra drugs for me to put in my little diary in my study of oncology aesthetics. How come it won't go? It won't move. Sorry, I have a bit of a hiccup here. Oh, okay. Right. Most of the time, people talk about spas, but don't really know what it stands for. Actually, SPA is an acronym of Health Through Water, Sanam per Aqua. A chance visit to a French Thalazzo medical resort spa changed my whole life. I quit music and I said to myself, I'm going to do it. I'm going to open a Thalazzo spa. And in 1988, the spa was opened and I was very happy to introduce something different and new. Of course, along the way, I added phangotherapy to the spa. And then I opened Renewal Day Spa in 1994. And we had all those wonderful treatments. Now, in 1996, I was diagnosed with lupus. I faced a health challenge, but I stayed positive and I was very convinced that I'm going to overcome this condition of mine. In fact, I was told that I had probably about 6-9 months to live. What I did was, that wasn't meant to be a setback. In fact, it propelled me to look into alternative therapies. And there I go to SPA in Germany to learn of their therapeutic methods of restoring health. And I invited 2 doctors from China to come to Singapore to work with me because I was very interested in TCM with regards to my condition. Then I delved into advanced aesthetics and then said to myself, what am I putting on my skin? I better know what's inside that product. So I headed off to LA and did a course on cosmetic ingredients. And then I got better. I beat the odds. It was more than 9 months past. I decided to give myself a treat and went to Czech Republic. And of course, my holidays are always medical resort spas, not shopping. And then I have met a lot of women in my career asking me, I have cancer, what can I do for my skin? I decided then I would like to learn more about oncology aesthetics. I headed off to Sydney and and as a result of which it changed my whole mindset, even changed the way I operate and do my services. So here, this is my personal mission: conscious, always education, training, learning, and formulations of products. And of course, never too old to learn. So these are the often heard questions. I'm going to take it into 3 phrases. Before, fortify, during your treatments, calm and soothe. And then recovery is after the last treatment you've got. It's calm, balance, and soothe. I need to tell you, ladies, that I'm going to take the long and narrow route. It's going to be very conservative. I'm not going to tell you today, yes, you can go and do your Altera, you can do your lift, you can do your collagen. I'm just speaking strictly the time before when you are diagnosed, whilst you're going through treatment, and 6 months after. Now, the skin is, of course, like everyone knows, is the first line of defense against infections and germs. And when you are diagnosed with cancer, the last thing you would think of is about your skin. But unfortunately, the true fact is the treatment, although it's targeted at your body, skin reactions are inevitable. So phase 1, before treatment, what should you do to fortify your skin ahead of your health challenges? I do not like to use the word cancer treatments or lupus treatments. I always call it a health challenge because for me, I tell myself a challenge has to be overcome. Okay, first thing you have to think about is exfoliation. It's not going to thin your skin because it's a process of removing dead skin cells. And anyway, your skin naturally shells dead skin cells to make room for new cells. And we call it the skin cellular turnover. It's automatic. You may not realize it. This is what happens. That's the top layer of the skin, which is epidermis. Then the lower layer of the skin, which is dermis. And of course, then you have your fat and you have the muscles. Now, this is what happens. Our skin is very, very clever, all right? New cells are formed at the dermis. It rises to the top to replace the dead skin cells that is naturally sloughed away. So we need to know and we need to understand that sometimes we have to take measures to accelerate the cellular turnover cycle, because this is what happens. When you're a baby, your cycle is only 14 days, but when you're teens, it's 28, and when you're 20s, it's 30, and it extends as we go along. And my goodness me, I admit my age, I'm much more than 50s. If I don't take care of my skin, my cycle would be 84 days. Now, what we need to achieve here is to bring our cycle to 42 days. Now, this is very important for ladies who are going to meet health challenges, because if you have a whole amount of dead skin cells that's stuck onto your skin, your wound healing would not be as effective. Now, I'm going to put you through something really fun, and I practice it. All right, it's the European holistic morning ritual. And it's very common in Europe. And these are the benefits. It's not just about staying beautiful. Most important, it increases your blood and lymph circulation. So what you do is when you wake up in the morning, open your windows and get ready for your body brush. After your body brush, of course, you have to jump in. How do you body brush? Here's the tool. You have to have a bristle brush with a very long handle, and don't get something soft because it's not going to work. And then the method of doing it. You have to start at your feet, always moving upwards towards the heart. So you start at the right, front and back, up your legs, up your arms, front and back. And then at the chest, you need to also brush towards your lymph nodes. And if it's the middle of your chest, you brush towards your heart. At your breast, under your breast, at the sides, brush towards your lymph nodes. And then where your abdomen is, brush circle clockwise. Yes, always remember, not downwards towards your heart. Now, after you brush, what do? You have to go for a shower, right? So do it the European way. In Europe, it's cold water. It's wonderful. It's invigorating. But in Singapore, it's fine. We still can adapt to our temperatures. Please cut out hot water for ladies that are going to face health challenges. And I think you will understand why. So start with warm, move on to lukewarm. And just at the end, turn off the hot temperature. And believe you me, you won't get a flu. You feel refreshed and alert. After you've done that, you pat yourself dry with a towel, but keep your skin still slightly damp. You apply body moisturizer or body oil. Envelope yourself into a luxurious toweling robe, recline in a sofa, and what you need to do is do your deep breathing at least 7 times. After all that is over, reward yourself with a hot tea cup of chamomile. So there, every morning try and do it. It's your me time. Okay, what should we do for the face? Now with the face, there's the microdermabrasions, the ultrasonic, there's the chemical peels. With microdermabrasion, you need to go and see your esthetician. And if you're diagnosed with cancer, I think you should share that with your esthetician, because then she would know how to adjust the setting and realize that she has to be a little bit more gentle. Another way is for you, go to the shops or go online and buy an ultrasonic exfoliator. It looks like a scrubber, and it goes, brrr, it vibrates. It vibrates because it's loosening and lifting your dead skin cells. So that is a good solution there. But if you want a thorough ultrasonic exfoliation, of course, you have to go to your esthetician. Now, chemical peels is very, very effective in removing dead skin cells. So when you have a peel with your esthetician, ensure that your peel is no more than 20%, the pH is less than 2%, and the peel is buffered. And also that the esthetician has to be there all the time watching your skin and wait for reactions. Oops, sorry. Yes, after you have sloughed off the dead skin cells, what do you have to do? Hydrate. Now, the secret or the key component of a strong, functioning, resilient skin is a hydrated skin. And you need to have your skin resilient, ready for the challenges ahead. So what is hydration? It's all about water, and we all know that, right? And take note, 60%, our skin has got about 64% of water. We drink more water so that we won't be hydrated. And then of course, everybody knows you're well hydrated, your skin looks plump, moist, supple, and your texture is smooth. But however, it's very important to note that after you shower, you do lose water from the skin. So that's why it is very important after you wash your hands, now that we have to do it frequently, or that you jump into a shower, you need to apply a moisturizer. And then our later slides will tell you why. I hate to have to bore you with a dissection of the skin, but I always felt that, you know, it's good to educate and to let you know so that you understand. If somebody says hydrate your skin, you know why. Now, stratum corneum, you see epidermis is your top layer, dermis is your lower layer. Now have a look at it. The topmost layer is 15% of water. The second layer is 3%, and way down at the bottom at your dermis, it's a reservoir. Now, the wonderful thing about it, that water does not just remain on its layer. It transcends through your whole epidermis and dermis. So the water moves so that you have a constant source of hydration. However, when there is a transepidermal water loss, what happens is that the water moves from the deepest layer, it goes up to the stratum corneum. It doesn't stop there, it just whiffs off into the atmosphere. So you have lost water. So that explains why you have dehydrated skin. And if you look to the right, 10% all the way down. And that is the reason why your skin looks dehydrated. And in fact, sometimes these sort of conditions could be medical conditions, and a person can look like a raisin. So remember this, maintaining hydrate flow, optimal water concentration is essential. Now, most times we talk about skin, us ladies, we always say collagen is lasting, built up, so I look plump and firm and lifted. But many people forget there's one very important function, and it's called the skin barrier function. And I went into this religiously because I had cutaneous lupus and my scalp was affected, and I pried my complexion, and I was really worried. Will it affect my skin? Now, what is a skin barrier? Basically, it's the outermost layer. And it's got a hydrolipid barrier that protects you from aggression. Now, the aggression could be pollution, it could be irritants, it could be I hate to have to say it, the aggression could be your health challenges that's about to come. All right. So it is very important that we have to keep the skin moisturized and protect the hydrolipidic area. Now, most of you who buy a lot of cosmetic products will probably recognize NMF. Yes, it is in our skin, and the purpose of the NMF is to capture and retain the water in our corneal layer. Now look at it, way down at the dermal matrix, that means it's the deep layers of the water. It's where it retains water. And look at the word hyaluronic acid. Now, a lot of you ladies, I know, go to your medical aesthetic doctors and have boosters to put hyaluronic acid into your skin. Well, just to let you know, it's naturally in your skin. Okay, just imagine the healthy skin barrier as, okay, Great Wall of China or a wall. So the cells are the bricks, and the lipid matrix is the mortar. So when everything is compact and everything is fine, it looks wonderful. It is good because you're preventing foreign invaders from coming in, and you are preventing your assets of your country from moving out. But when you have a damaged wall, the bricks collapse, the mortar cracks, then you are open to a lot of foreign invaders and things that are not savory. So just to go back into skin barrier. So if it is healthy skin barrier, your skin looks plump and moist and glowing because your asset is your water, it hasn't escaped. But if you have an unhealthy skin barrier, water escapes and everything goes askew. So your skin looks dry, flaky, and dull. And of course, a lot of women say, why I have wrinkles. That is also one of the reasons you don't have moisture in your skin. Now, this is very interesting. What damages the skin barrier? Then you say, okay, I need to protect it. What is it that will damage? I put right on top, sorry, Carmen, I put Dr. Wong, I put on top health challenges, which means cancer treatments. And the next thing that would damage your skin barrier would be, of course, pollution, cigarette smoke, UV exposure, and that's the reason why you have to keep using your sunscreen. Very important is overconsumption of alcohol and poor diet, and take note, harsh scrubs and soaps, and of course, extremes of temperature. Now, when your skin barrier function is damaged or disrupted, you will have what we call transepidermal water loss. That means you're losing water from the deep layers of the skin, and it just moves up to the top layer of the skin and it just evaporates. So here again, I'm just emphasizing on what I've spoken to before. Skin with barrier intact, you have no irritants that could affect you, and your moisture is kept in your skin to keep plumping it and to keep it healthy. However, if your barrier is disrupted, damaged, as in this illustration, it's very obvious. Now then you say to yourself, oh dear, what can I do about it? Skin moisturizers. Now moisturizer is a very generic word. It just means it could be a gel, it could be a cream, it could be a lotion. What's inside your moisturizer is important. So you have got two agents that are very important to help maintain a healthy skin barrier. One, think about it, is humectant. The humectant works like a sponge. It draws water from the environment and it keeps water deep within the skin. Then the other one is, it is just another illustration of it like a sponge. Then you have the occlusive. What the occlusive does is like cling wrap. It works as a physical block. It stays there, it locks the moisture in, and it prevents moisture from being evaporated. Now, most of us, when we buy cosmetics, what do? The first thing we do is smell. The smell is very important. Like saying, we go touch, 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 touch. No. Now that you are having these challenges, turn the bottle around and look at the back. Start reading ingredients. Look for your occlusives, and here, this is what they are. Cold pressed oils. I believe in cold pressed oils because the oils are crushed from the seed, so there's no chemical residue, and the characteristics of the seed is well represented in the oil, so it's highly therapeutic. Of course, everybody knows aloe vera, shea butter, allantoin, and no, NMF. Yes, cosmetic labs make NMF to replace the loss of NMF of your skin. And face masks. I know a lot of you women would love face masks. Face masks are very, very good occlusive. They occlude your skin like a second skin. But after this talk, please don't go and call your friends in Korea and say, hey, send me a backload of masks. No, 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 no. Less is best. Quality is best. Just ask for hydrating face masks. The humectants, sodium hyaluronic, actually is a lower molecular of the hyaluronic acid. Now, glycerin is a woman's best friend, not diamonds, because this is the super sponge. It just absorbs water and keeps it in. Urea is an amino acid, and that's found in your skin. And of course, look for saccharide isomerate. Now, there's one thing I would like to, at this point, caution ladies. When I was first diagnosed, I said, oh, I have to go natural. Oh, I have to go organic. I think one needs to learn that not everything organic is good and not everything natural is good. And do not allow yourself to be swayed by this pitch, no preservatives in your product. Because if there's no preservatives, as I often ask, there's a possibility of the mold, the fungi, and the bacteria. Now you are having a low immune system and you're going to be subjected, or rather the skin is going to be subjected to a lot of challenges ahead. You cannot afford the risk. So in summary, I'll run it very quickly because I'm told that I've got 20 minutes. I'll do the best that I can. So I'm going to click everything in. Okay, gentle cleansers with soothing, hydrating ingredients. Spray, don't wipe, spray toner to balance your pH. And ladies, please purchase products with fewer ingredients. Don't go for that line, oh, this product got peptide, then it got this, and then it got that, and then it's going to lift, it's going to plump, it's going to stretch your skin, it's not possible. The product itself will go crazy. What works for your skin? Fewer ingredients is better. Apply your moisturizers morning, afternoon, and evening, and this is a must. Apply sunscreen every 2 to 4 hours. Avoid the sun between 12 to 4. Please understand that whatever I'm talking now is for women who would be facing health challenges. It's not for the healthy ones, but nevertheless, there's some things that could be interesting to you. Now, irritants. Very important, the common one is sodium lauryl sulfate. It's actually a surfactant and is put in your shampoos and put into your cleansers. But it is an irritant. You find SLS in the detergents that wash your dishes, in detergents that clean the floor. So you definitely do not want to clean your face and wash your hair with SLS. Now, parabens. Parabens has always been a controversy, but recently EU has banned parabens. It is declared a carcinogenic ingredient. What it does, it is a preservative. Now, parabens are used in body deodorants. Women, what do? Of course, body deodorants, you puff it under your armpits. And clinical research has shown that women who use body deodorants constantly do somehow develop breast cancer. And of course, the next thing, synthetic fragrance. Why? Because it can be irritant. And start washing your face with cool water, sun exposure, and the alcohol and smoking is a given. Now, the other thing that very few people talk about is or understand the pH of skin. This is very, very important. We need to know the pH of skin and the pH of our products. Our skin is actually quite acidic. And if you look at pH scale, it goes from 1 to 14. And the reason why I put this slide in, because there's always this discussion, what, Elizabeth, you mean I cannot use soap, but my soap is herbal soap, my soap is soft soap and all that. Let me tell you why. Soap uses an ingredient called ley, and the pH of ley is anything from 9 to 14. Now, too much alkaline is also not good for your skin. So as I had told this friend of mine, it's fine. It's okay when you are not diagnosed with any medical conditions like myself, autoimmune and so forth, and cutaneous one. I prefer not to go for soap. I'll go for the lesser evil, which is cleansers. But when I buy cleansers, I always look and make sure it's got a hydrating property inside. So when you wash your face with a cleanser, then it veers more to the orange, and maybe if it is a little bit stronger, if you want to control oil, it goes to the 3. However, how do you bring back your skin balance from the 3 and 4 back to your 5.5? You need to use a toner. So that's why a lot of times it's not a sales gimmick. Oh, you buy this cleanser, therefore you have to have the toner. And the toner has nothing miraculous in it. It's just that the toner ensures that all the cleansing residues, all the surfactants that is on your face is completely wiped off. And here, of course, everybody knows sunscreen and sunscreen and sunscreen and so forth. So the A is the aging ray, as I call it, and the B is the burning ray, and that's the one that could cause cancer. The thing I need to just explain here, because the rest of it I'm sure you know, is that about the SPF, sun protection factor is actually telling you is protecting UVB. So when it says SPF 30, it protects 97% of the rays. And there are now cosmetic brands that come up with SPF 50, and of course they charge you almost double the price. Now, just to let you know, SPF 50 is just 2% more of reflecting of the rays. So you don't need to pay double just for 2% more. And make sure that your sunscreen is full broad spectrum, because you have to protect from UVA and UVB. But there's something that has come up recently, and a few people do not realize it. Blue light. Blue light is emitted from our smartphones, our tablets, our TVs, and our computer screens. It's not very good for our eyes. It can cause macular degeneration. But the thing that is quite worrying is that it is possible it causes hyperpigmentation. Now, if you're going to go through your health challenges, which is going to cause you hyperpigmentation. You do not want to have a double whammy. So minimize your exposure. I'm sorry, ladies, cut out on your WhatsApp and your Facebook. It's better that way. Now, lymphatic drainage, this is something I'm a firm believer in. When I was just recovering, when I think I had my first onslaught of lupus long before I knew it was going to happen. I would feel fatigue. So 40 years ago, when I was in UK, I was recommended to try a lymphatic drainage massage. And of course I went, and after 5 minutes of the massage, I literally wanted to stand up and walk away. I said, what is this? She's not even touching my skin. What am I paying all these pounds for? Because I'm so used to the Asian massage, the more pain, the better. But after the treatment, I felt all the wonderful benefits. I was shopping a lot. I was wearing tight boots. My legs feel lighter. And my skin, I didn't look puffy. My skin tone improved. And I did detox, but I can't share how with you, with some of you ladies. This is private. But at the end of the day, I tell myself I'm a strong advocate of manual lymphatic drainage massage. Now, it is important for you to consider this because it's a very good pre and post cancer therapy. So you should have 2 to 3 manual lymphatic drainage massage before you enter into any treatment. Now, the next phase is during. I'm not going to give you there's no miracles here. It's all about soothing and healing, because the reactions and the recovery process differs from different people. I can only recommend about scars. And one way to reduce the possibility of a skeloid or a scar being too deep is that after you remove the stitches, massage that area with cold pressed oil. And the oils I would recommend would be the argan oil or the moringa oil. I've seen it done, I've recommended it, and it is really what it promises. I'll just go on this pain relief because I'm also was a music therapist. When I'm feeling down, when I have to be pumped up with so many steroids and I look from a slim to a fat, not so presentable looking lady, I was feeling very demoralized. So I'll go for massages, and then of course, being a music therapist, I'll turn on my favorite music and just relax. Chemotherapy, I think we heard a lot about what all the chemo drugs and so forth, and I think a lot of you know chemotherapy does affect the skin, and you've got cirrhosis, you've got pruritus, you're dry, you're scaling, you're itching. And the subject that a lot of women talk about is what is happening to my skin? I've got this pigmentation. I'll address that later. So the other reactions, I'm not an expert on hair. Dr. Carmen Wong is the person that you should go to. Some of you may be jumping up and down, but for myself, I'm sharing personally, I avoid hair dyes, and I recommend pressure point massage to encourage blood flow. And I just shared with Dr. Carmen Wong, one of the best hair treatments I can think of is the Indonesian cream bath. Go ask your Indonesian friends what it is. I do not advocate manicure and pedicure whilst you are undergoing chemotherapy, simply for the reason of reducing the risk of infection. But what you can do is to nurture your cuticles and your nails with cold pressed oils. Radiation therapy. Now, the relief, and actually this came from a friend who is a beauty expert, and she had 30 radiation therapies. And she said, Elizabeth, you know we are in the beauty business, so we always know we put serums, we put night creams, we're always nourishing and moisturizing our skin. So she said, before radiation therapy came, I went all the way. Instead of applying just in the morning and the night, I apply every 4 hours. The moment I feel that it's been absorbed, I would then slather another lot of moisturizers. She puts a humidifier in the room. And of course, on radiation day, you do not apply any moisturizers, but straight after radiation, pat on your skin moisturizers. I say pat, not apply, because you want to be, you don't want to cause any friction on the skin, and pat helps the product to penetrate further, and of course, wear your sunscreen. Hormone therapy. It's a strange thing. When I had lupus and I was given big doses of steroids, I was going through like a menopause symptoms, or maybe I played it up with my husband, but really it was quite bad. You will experience mood changes, mild skin rash, and hot flushes and sweats. When I did my program in Germany, this is what they do. They do cool compresses, always cool compresses, or where you feel quite uncomfortable. And then there will be the heat and the cold packs. It's the alternating temperatures of water that is supposed to provide some medical, some relief. And in many ways, most important is to reduce inflammation. I highly recommend Swedish body massage with blend of essential oil, because when you're hormonal, you just want to smell something nice. However, with essential oil, is not the topic for today. One needs to be very careful on choice of oil. I recommend here then the Roman chamomile. Then of course have your MLD massage. And please avoid the lots of pain, then I get the gain kind of massage. That is a no-no. So here are all the tiles. And the main reason for having the dry skin, the itchy skin, the rashes that you get from radiation recall is because of the disruption and the damage done to your skin barrier function. Okay, so now I go on to the next slide. Now this is going to be very general. Like I told you, I am just taking a very conservative route. Frequent application of moisturizers and serums and cold pressed oils. And yes, if you're going to go through cirrhosis, you can layer your application. You can first put your serum, moisturizing serum, then you put your moisturizing cream, and then on top of your cream, you put the cold pressed oils, and it acts as a good clean wrap to keep the moisture in whilst you're sleeping. Always spray toners after you wash. And I'm also a firm advocate and believer in aloe vera. You don't have to get any fancy stuff for your rash, just aloe vera. And for anything that's itching and burning, moist compress, you can drop 1 drop of lavender oil on your compress. That works fine. Avoid perfumed products, and please replace your soap with face and body wash. Then the creating of a relaxing atmosphere. I know a lot of you have essential oils and have diffusers in your home, and it's so romantic, it's so beautiful when you burn your essential oils with a candle and so forth. But please remember this, avoid burning with the candle and wick, because candle and wicks can be toxic. It's the quality of the wax. So refrain from that, get yourself a nebulizer instead. Hyperpigmentation. This was brought up many a time, and had conversations with Dr. Carmen Wong. She says women have been asking, during your treatment, you should not be going for any aesthetics services. Just keep applying products that have brightening ingredients. Don't get excited and get yourself the highest concentration of vitamin C, because that can irritate you, vitamin C, because why? is veering towards the red of the pH scale, and you cannot afford any irritant. And by the way, vitamin C, it makes our skin photosensitive. Avoid tretinoin, hydroquinone, and don't visit your estheticians or your dermatologist whilst you're having chemotherapy. It's no point. The chemotherapy darkens your skin, and then you try to go and lighten, and then there's a ding dong and ding dong. At the end of the day, you are overburdening your wallet and overburden your stressed out skin. Yes, it can be stressed. So I thought, instead of waiting for questions, what's the brightening ingredients, I printed it all out for you. If you are on the botanical angle, the people who like natural, then look for mulberry, which is a botanical alternative to vitamin A, and licorice root extract. Yes, you can still have vitamin C, but on another form, L-ascorbic acid. You could also have these mild acids that help with brightening, and retinoid is good. Not that it's going to do away with your melanins, but it is good for the skin cellular renewal. So once you get rid of dead skin cells, in some ways you're reducing pigmentation. The key gold ingredient here is niacinamide. It's a vitamin B3, and of course, alpha-arbutin is quite commonly found in brightening products. Folliculitis is actually it's an acne-like skin rash. What is the relief? If you treat it like acne, it's a no-no, because acne products, remember, that is acidic, so it veers to the left, to the red, and you don't want that. You've got already, your skin is already highly stressed. But what is suitable is application of antibacterial oils like calendula, and I'm sure you're all familiar with tea tree oils. But if you want to buy a product, the botanical ingredients are willow herb or white willow bark. And lymphedema, all I need to say about this is that it's a very strange thing. Some people have it and some people don't. Some people who have then nodes removed doesn't affect them, but others affects quite badly. I'm not here to be your lymphedema specialist, but I'm just focusing on skincare. If there is such a condition, go for cold pressed oils. You don't need essential oil blends for this, just cold pressed oils. And moisturizers, no, it doesn't really work effectively, not for this condition. So just remember this, the end of your cancer treatments does not mean the end of your contraindications. So once treatment is over, please don't go to your esthetician and say, give me the best you've got, money, no object. No, 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 no. Now is the time to continue with the soothing, the hydrating, and in the middle, the balance. Shorter duration of facials, less protocols is better for your skin. So I'll just give you very quickly an example. Speak to your esthetician, tell her you have cancer. You need to tell her that because she needs to understand. The touch is very important. It's always gentle touch. Safety is very important. Now, this is no steaming, because some of the cancer therapies actually make your pores larger, so you don't want to have to steam. So, and enlarge your pores. Very gentle exfoliation. Some beauty services give you that ozone is supposed to kill bacteria. No, 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 because it produces free radicals and you want to avoid that. And of course, ensure they have clinical standards of disinfecting. The products should be unscented, non-irritating, and especially formulated for sensitive skin. Now, if you have acne, I know, actually I slipped this in at the last minute because I know I've been told to speak for 20 minutes and I'm trying to rush here, but I thought I'll just put it in and not just wait for the questions. If you have acne, salicylic acid peel. It's antimicrobial, anti-inflammatory is ideal, but the percentage has to be very, very low. LED light therapy, I highly recommend, is the blue light helps with, of course, reducing all the inflammation and the bacteria and so forth. Your esthetician can come up with some decongesting phase therapy. It's a combination of few of the treatments, but like I said, no more than 60 minutes for your visit each time. Pigmentation, at this moment in time, there's nothing miraculous. I advocate glycolic acid peel, because glycolic acid peel efficiently sheds off your dead skin cells, and it does one thing more. It stimulates the production of new skin cells. So your melanins always are right at the top of your skin layer. So as you're exfoliating and you're sloughing off the skin layers, there's some form of reducing your pigmentation. LED light, of course, and then the other thing, if your estheticians do it, an infusion of brightening products would help. Body treatments, very simple. Please avoid the beautiful spa treatments of wrapping with seaweed and all that. You don't need hot treatments. Now, reflexology is fine, but I'm not an advocate of the Taiwanese and Chinese where they probe your skin and they press your skin so much that I jump up in pain. I'm an advocate of Ingham methodology. And if you want to know who practices Ingham, please write to Breast Cancer Foundation and I will give them the information. Again, MLD, and yes, why not a Swedish massage with an essential oil blend? So the safe ones definitely is lavender, Roman chamomile, frankincense, and patchouli. And I hear there is a hydrotherapy center. Indulge in Vichy showers, all kinds of showers, but don't jump into the balneotherapy tubs. Also, you don't want to risk infection. So I'm going to end with a testimonial. Jeannie Sim, she is a world skill expert in aesthetics. She's an international trainer for the CEDESCO, which is a beauty diploma. And she was the one that shared with me her experience with radiation therapy. And she said, Elizabeth, all I did was 30 radiation treatments. I just put on all my moisturizers, all that I've got, and I layer my skin in the evening. I drink a lot of coconut water, and after each radiation therapy, I make sure I carry my moisturizers with me and I apply immediately after. And you see, like I said, recovery is different from different people, because when I saw her during the radiation, it didn't show. She didn't burn, she didn't lose her hair, but she was feeling fatigued and she was not feeling very well. Anyway, she and I, we are the tough warriors. We had a challenge and we were determined to overcome. And now Jeannie has migrated to Porto, Portugal, and living life to the fullness each day and enjoying whatever bearings it comes. So for you ladies, thank you very much for listening to me. I hope I didn't breeze along so fast that you're not able to catch, but whatever it is with your health challenge like mine, stay positive, you will overcome, and there will be very, very important, interesting future ahead. Thank you.
Thank you so much, Mrs. Elizabeth Wong. Now we've overshot our time, but we do have some questions that we need your expert advice on. I think we would just need to flash one of the questions that just came up, and we might not be able to answer all, but we'll try. We'll answer at least about 3 to 4. The first one is actually what you actually just covered just earlier, and this is just raised up, but I thought it's a very, very important, it's an important question. There are many essential oils out there that can help soothe our skins, which you had actually indicated, yang yang, tea tree, and lavender. I think you had highlighted tea tree oil was important. But is it dangerous for women with hormone-based breast cancer, since they contain estrogenic-like properties? Maybe you can help answer that question, Mrs. Wong?
Actually, I have a list and I don't have it handy here. I have a full list of essential oils which hormone-based breast cancer patients should avoid. But essential oils like lavender and tea tree, they are quite safe. The ones to avoid are aniseed, clary sage, and that's a no-no for estrogen-based cancer. Geranium is also to avoid, and jasmine, marjoram. Actually, I have a whole list here, and it will take too long for me to share the list of what oils to avoid. Not everyone is dangerous. So please write to Breast Cancer Foundation, and I'll be very happy to share that list. Oils to avoid.
Okay, thank you very much. The next question was actually a question that was posed earlier. And if we move to the next slide, this I would direct to Dr. Carmen Wong, because this here we talk about how, you had highlighted that acne will come up, but this lady has actually developed eczema during the chemo treatment. And she already had sensitive skin prior to it. And what has happened, it was that because of the chemo treatment and the eczema, the skin started to darken around the armpit and the fingers and around the mouth area. How, I mean, there are two questions here, but Dr. Carmen Wong, maybe you can help answer this question, please. Dr. Wong, you're on mute, sorry.
I'm so sorry to hear about your misadventure. Now, we do know that eczema is relatively common during the treatment of breast cancer. And sometimes it can even occur after treatment is over. And in general, these are not acne, these are eczema. It's just like any other rashes that come up. And what is interesting, according to my dermatology friend, is that the flexor area. Now, what is a flexor area? The groin, the armpit, the crease on the elbow and the joint. Those areas tend to have a stronger inflammatory reaction. And the inflammatory reaction is being seen as hyperpigmentation. They become darker than the other area. So truthfully, when the eczema is over, it should get better. So to treat the eczema, you might need to talk to your doctor by giving some anti-inflammatory, either lotion or sometimes maybe even a tablet. So this is like you have a scar, you have an inflammation, the pigment were there because it's a post-inflammatory pigmentation, and time will actually make it go away. And in some situations, you are really, really impatient. We do know that some laser therapy are effective in eradicating pigmentation from post-inflammation. Then you may need to speak to your dermatologist. But please do not do it immediately after your chemotherapy or cancer treatment. Give it a couple of months, maybe 6 months as a reasonable time to do so. Otherwise, you may create a little bit more complication thereafter.
Okay, we'll have one more question, which is about hair. Okay, so one question that came up because we are cognizant of the time. The first patient did say that my hair is still falling. It's 4 years after remission. What can I do to strengthen my scalp? Dr. Carmen Wong, please.
Well, this is a universal problem. I mentioned that there are many reasons why women lose hair in breast cancer treatment. Number one is that if you are young and you make menopause itself, women drop hair. And if you are on a medicine called aromatase inhibitor, there are 3 agents in the market, and they do cause hair loss. All right. So I think it's a combination of aging and hormonal changes, maybe the drug. Unfortunately, there is a lot of people spend a lot of money on hair growth. And I would not say that I have a particular formula. We do give people medicine lotion to apply. We use 5% lotion of what they call Regain to apply only for men and women. And then that is really nothing magical. And unfortunately, increasingly, hair transplant become quite a reasonable and realistic option. So yes, people also take biotin, which is strengthening nail and hair, but I cannot say that I have a magical formula.
Okay, thank you so much. There's only one more question that we have time for, and this I'm going to direct to Mrs. Elizabeth Wong. And it's a question about beauty again. How to prevent melasma? Is it safe to undergo laser facial treatments such as XLV or dual yellow when one is in remission? Your advice, please.
Actually, I checked with a doctor with regards to this because, but the important thing is, it's not about how to prevent melasma. The only way to prevent melasma is very simple. Use sun protection products and lightening products. That's the only way to prevent melasma. The other thing is melasma, it could be brought about because of perimenopause and because you're menopausal. And really, it's just using whitening products to prevent melasma. Now, if you're talking about undergoing laser facial treatments and so forth, I've been advised, and I'm talking the very, very conservative route here, that chemotherapy is actually a contraindication to any light therapy, even if you are on remission. So it's very difficult and it's not fair for me to tell you yes or no on whether it's possible, because the three simple words, it all depends. You have to go and see your doctor. You have to speak to your oncologist and ensure that the photosensitivity, which is a result of your chemotherapy, is well under control, because photosensitivity can go for an indefinite period. Now, if you still have that photosensitivity, when you do that light laser or any laser, it gets darkened and you will see adverse skin reactions also. So that is my straight down the narrow road answer.
Okay, thank you so very, very much for that. I do know that we were supposed to finish at 11, but I think we've been so enamored with all the information that we've learned from Dr. Carmen Wong and Mrs. Elizabeth Wong. I think we've learned so much because we realize that this is a journey. This is something that we can benefit from, and we have seen from what Dr. Carmen Wong has said. We just remember, ladies, we're all very beautiful. There are challenges that will come our way, and as what Elizabeth Wong has shared with us, this is a challenge and an opportunity to develop ourselves to be stronger than what we were before. So we would like to thank all our speakers and thank all of you, our attendees, for attending this session. It has been enlightening. It's been something that I believe we have benefited so much from, because there are even more questions that we haven't answered. We only covered the tip of the iceberg, but we will definitely try to answer it and email it to the relevant people who had sent in their requests. If you could provide us with some feedback on how we can improve, the QR code is there, or drop us an email, because we'd like to develop more of this series. It's a lifestyle series that we've just recently developed in our webinars, and we hope you have enjoyed the session with us. Thank you so much for joining us, and we thank you for staying with us for that additional 25 minutes. Thank you so much for that.
Bye.
Goodbye. Thank you.
We have a lot